Hi, I'm Dr. David Wilson. I'm an orthodontist, and I've been practicing in central Pennsylvania, and specifically Selinsgrove, for the last 33 years. Today I'd like to talk about upper jaw expansion. Narrow upper jaws, that's one of the most common things that we see every day and that my staff and I treat every day. So it's a very important part of my practice, recognizing that there is a narrow jaw and fixing it. You know, a narrow jaw causes lots of problems. Not only does it cause dark triangles or dark corridors in a patient's smile. If you smile broadly and you look at yourself or you look at your child, you can see dark corridors in the smile. Not only does it cause that because the jaw doesn't fill out the smile, but it causes lots of other problems. One of the most obvious problems is that it causes upper crowding. So the teeth are crowded because the jaw isn't wide enough to house all the teeth. The tongue, which needs space in the roof of the mouth, will push the upper teeth out to the sides. And because it pushes them out to the sides like this, it creates bite interferences that can lead to joint problems, temporomandibular joint problems, pain, and also can lead to excessive wear of your permanent teeth early in life that requires extensive restorative work, crowns, onlays, and things like that. More compensations occur also with the lower jaw, and that is that the lower teeth lean in to compensate for the narrowness of this upper jaw. And the way that that happens is that when the upper jaw is so narrow, the cheek muscles push in on the lower teeth as they're erupting. So this happens at age 6, 7. As these teeth come in, they get pushed in by the cheek muscles because the cheek muscles are supposed to be held away by the upper jaw. Upper jaw is too narrow, and it doesn't do that, and the teeth lean in like this, and as they lean in, it causes crowding of the lower front teeth. So the crowding of the lower teeth is many times due to the narrowness of the upper jaw. And unless you recognize that and solve the narrow upper jaw problem, your orthodontist or your dentist, if he does orthodontics, may say to you that you need to have teeth removed. And it's very rare in Wilson Orthodontics that we remove permanent teeth because we've diagnosed the transverse problem, we fix the narrow jaw, and we fix the compensations that occur with the upper teeth leaning out and the lower teeth leaning in. So let's talk about how we create this Wilson smile. You know, because we know we've got to correct the narrow jaw problem, and we need to get to the point where we've got this gorgeous broad smile, because that's what patients want and that's what parents want. And you know, with that, it's a healthy smile. You know, it's not just that it looks good. The teeth fit together well. There aren't interferences. The bite works really, really well. So let's talk about how we do that. Well, we use appliances that allow orthopedic correction of a narrow jaw. This is one example, and it's a fixed appliance that is glued in place. It's custom made to fit the person perfectly, and I personally make this appliance myself for my patients. Once we make sure it fits well and we glue it in place, we have the patient's parent or another person activate the appliance with a key. The key looks like a blue popsicle stick with a paper clip on the end, and that key is used to activate the appliance. The key is simply placed into the little hole in the expander in the roof of the mouth area. This is painless. Key fits in the hole. You push back like this to activate it till it stops, and then just slide the key out. That's it. When you do that, you've expanded the appliance, and this is called a jack screw, 1/4 millimeter, very tiny amount. It's enough that a patient will feel some pressure that lasts about 10 or 15 minutes. Very mild pressure, by the way. This is not hold your face and moan, I can't go to school. And that pressure disappears after 10 or 15 minutes, and at that point, it's painless. So it is something that you do once or twice a day to correct the narrowness of the jaw. You're expanding the appliance and you're expanding the jaw itself. Up until a certain age, around age 11 to 13, that suture that connects the two halves of the palate is open. And so we can expand that painlessly, without surgery, to a better width, hold it there, and then it grows. It takes about 3 months to grow it there. The correction is stable, we can remove the expander, and we have a new width to the upper jaw. We then correct the other problems. We correct the teeth that are leaning out, we lean those back in. The teeth that are leaning in on the bottom, we lean back out. And lo and behold, we've got a Wilson smile with no crowding, and we've got the dark corridors in the cheek areas are gone, and we have this whole new person who's a whole lot more confident and self-assured in his or her smile. So I want to thank you for listening to me. I got a chance to talk about one of my favorite subjects, and that's correcting narrow jaws and creating beautiful smiles. So I really enjoy what I do. I'm one of those people that gets up in the morning and I love to come to work because I love to create beautiful smiles. I appreciate the opportunity that I've been able to treat all these patients in Central Pennsylvania, and I look forward to treating a lot more. Thank you.